2021 was filled with stories about problems with Fayette County's juvenile detention center known as the Wilder Youth Development Center. We're starting 2022 with a new report from an advocacy group for people with disabilities accusing Wilder of breaking state law in how it operates, even alleging it is actively endangering the welfare of children. Jenny DePrizio talked to one man who says his child has experienced this firsthand.
And I just want everybody to know that kids are going to a facility where it is extremely dangerous, and there's nothing they're doing about it but covering it up.
Raymond Taylor wants the public to know what's happening inside Wilder Youth Development Center. Wilder is a state-run residential facility for troubled youth that Taylor says is out of control. According to Taylor, when his son Brian refused to join a gang, he was so badly beaten his son's hip was broken. And then Taylor says it was more than a day before his son was taken to Le Bonheur Hospital.
That's not a place for no child.
There was a staff officer standing at the door of that room where that beating was occurring. The staff officer was aware that that was happening and did nothing to stop it.
Jack Derryberry with Disability Rights Tennessee says what happened to Taylor's child is just one incident of many. The advocacy group says over the last 18 months, they've investigated many instances of Wilder failing to keep kids safe.
DCS is supposed to keep kids safe. They're supposed to provide evidence-based rehabilitative, behavioral, and mental health treatment. Instead, DCS is actually subjecting youth to the kinds of abuses that they are mandated to protect them from.
Jasmine Miller says the conditions at Wilder are horrific, and that's one of the reasons there are frequent attempted breakouts and incidents at the facility. According to Disability Rights Tennessee, the group's investigation found staff mistreating youth, unnecessary use of restraints and isolation, failure to treat medical conditions, depriving youth of hot food, extended lockdowns, and lack of providing the children the therapeutic and rehabilitative services they're legally required to provide.
The Department of Children's Services is not following Tennessee law or best practices when it comes to youth in the juvenile justice system, specifically those young folks who are placed at Wilder.
The youth feel unsafe and feel hopeless. They don't think that there's any chance of them being safe or of them getting the services they know that they need.
Derryberry points out almost all of the children at the facility have diagnosed psychiatric conditions, and he says the children aren't getting the services they need.
Wilder is not being run correctly. It is not a good use of state funds. It is not evidence-based. It is not meeting the treatment and rehabilitation needs.
As for Taylor, his son has been transferred to a different state facility, but says if something doesn't change, someone could end up dead. In East Memphis, I'm Jenny DePrizio.